All right, today we're going to get into a really interesting one. It's a condition that takes something we do without even thinking, swallowing, and turns it into a serious daily struggle. It's called achalasia, and it's a fascinating medical puzzle. So let's dive in. I want you to just imagine this for a second. Every time you eat something, or even just take a sip of water, it goes down your throat, travels all the way to the entrance of your stomach, and just stops. It gets stuck. The door is jammed shut. That feeling, that frustrating, painful reality, is exactly what it's like for someone living with achalasia. So, where does this all start? What are the first clues that something is seriously wrong? Let's take a look at the symptoms that usually bring someone to the doctor's office in the first place. Okay, so these are the big ones. It almost always starts with trouble swallowing. But here's the really specific clue for achalasia. It's a problem with both solid food and liquids, often right from the get-go. That's a huge red flag. Then you have food coming back up, sometimes hours later, chest pain that can be so sharp people think they're having a heart attack, and of course, because eating becomes such an ordeal, people often lose a lot of weight, fast. And this number right here, this is why it can be so tricky to figure out what's going on. This condition is really, really rare. We're talking about one person in 100,000 each year. So for most doctors, it's just not the first thing that jumps to mind. That makes the whole process of getting the right diagnosis absolutely critical. So with these symptoms piling up, how do doctors figure out that the door to the stomach is actually stuck? Well, let's follow the clues and see how they solve this medical mystery. It's usually a three-step investigation. They'll start with what's called a barium swallow, which lets them watch on an X-ray how things are moving or not moving. Then they'll often do an endoscopy, sending a camera down, mostly to make sure there isn't something else, like a tumor causing a blockage. But the final answer, the test that really nails the diagnosis, is called esophageal manometry. And check this out. This is the classic telltale sign they see on that first test. During the barium swallow, the liquid fills up the esophagus, but since it can't get into the stomach, it just sits there, creating this really distinct shape at the bottom that looks exactly like a bird's beak. It's an incredible visual clue that screams achalasia. So what is this gold standard manometry test anyway? Well, you can think of it like a super sophisticated pressure test for your esophagus. It gives a definitive yes or no answer to two really important questions. Question 1, is that door at the bottom, the sphincter, actually opening when it's supposed to? And question 2, are the muscles of the esophagus doing their job and creating that wave-like motion to push food down? In achalasia, the answer to both of those questions is a clear and simple no. So, after all that investigation, the culprit becomes crystal clear. It isn't a physical growth or blockage. The problem is all about function, how the esophagus is supposed to work. Let's just put it side by side. On the left, you have a healthy esophagus. The door, or LES, opens up right on cue, and those muscles give a powerful, coordinated squeeze, a wave called peristalsis, to push food right into the stomach. Easy. But with achalasia, the door just refuses to relax, and that muscle wave is gone. The esophagus is basically paralyzed. So the food just piles up with nowhere to go. Okay, so we know what's happening. The door is stuck, the muscles are paralyzed. But that just leads to the next huge question. Why? What's the motive here? What's the root cause of this total system failure? And the answer, it turns out, is all in the wiring. It's a nerve problem. See, that muscle at the bottom of your esophagus has two sets of nerves. One set tells it to squeeze tight, and the other set tells it to relax. In achalasia, those relaxed nerves have been damaged and they've died off. So the only signal the muscle ever gets is squeeze, and it just stays clamped shut all the time. So what's causing that nerve damage in the first place? Well, honestly, we don't have a 100% certain answer yet, but the leading theories all point to some combination of these three things. The most popular idea is that it's an autoimmune issue, where the body's own immune system gets confused and attacks those nerve cells. And that might have been triggered by a virus years earlier, especially in someone who has a certain genetic makeup that makes them more vulnerable. So while we can't just regrow those damaged nerves, at least not yet, what we can do is tackle the mechanical problem head-on. If the door is stuck shut, then the goal of every single treatment is pretty straightforward. Find a way to force it open. It's a pretty simple question, right? But it leads to some really clever and fascinating medical solutions. The goal is always the same. Relieve that pressure. Get that door open. But the way doctors go about it can be quite different.
Okay, so there are three main ways to get this done. First up is pneumatic dilation. This is where they literally use a balloon to stretch and tear the muscle fibers to weaken them. Then you've got the classic surgery, a Heller myotomy. A surgeon goes in and very precisely cuts the muscle from the outside to release that tension. And the newer kid on the block is called POEM, where they do the same kind of muscle cutting, but they do it from the inside with an endoscope. Each has its pros and cons, and a big part of the decision is balancing how well it works against the risk of side effects, like developing acid reflux afterward.
Now, what if somebody can't have one of those big procedures, or maybe they're just waiting for one? Well, there are temporary fixes. Certain pills, like calcium channel blockers, can help the muscle relax a tiny bit. And you can also inject botulinum toxin, yep, the same stuff as Botox, right into that muscle. It paralyzes it, forcing it to relax for a few months at a time. All right, let's just zoom out for a second and look at the big picture here. After someone gets a diagnosis and gets treatment, what does the future actually look like? This is probably the most important thing to understand. Because the nerve damage can't be reversed, there is no cure for achalasia right now. The goal isn't to make the disease go away, it's to manage the symptoms. But here's the great news. The treatments we have today are really, really good. For the vast majority of patients, these procedures do a fantastic job of opening that stuck door, giving them excellent long-term relief and letting them get back to just enjoying a meal. And that leaves us with a really cool question for the future. Right now, all of our treatments are focused on the mechanical problem, the stuck door. It's a workaround. But what if, as our understanding of nerve regeneration and the immune system gets better and better, we could one day go beyond just fixing the symptom and actually fix the root cause? Could we fix the faulty wiring itself? That, for sure, is the ultimate goal.